Remember this? You were called to a private residence in a low-income area. Your patient was an 8-year-old boy with a fever and dehydration. His mother said she would have taken him to the doctor earlier, but they didn't have insurance. You could see the family was struggling. Or remember this? You responded to the home of an elderly man complaining of weakness. During your scene assessment, you noticed he had very little food in the house. He was skin and bones. You asked him, "Do you have family we can call?" And he said no. And then there was the time you ran on that veteran with a rapid heart rate. He mentioned he was having trouble adjusting, and all you could do was say, "Hang in there." As rescuers, these are some of the things that make us feel helpless. Each month, the Resource Access Program receives hundreds of stories like this through your emails, phone calls, and electronic wrap referrals. One day we thought, what if we had an idea? We worked on this idea for 2 years. We built relationships with other organizations and collaborated with our technology partners. Did you know that 211 is a county service that connects you to more than 6,000 community health and disaster support services? And beginning January of 2015, you'll be able to refer your patients to 211 using your on-scene device. So imagine this. What if you could say, okay, we need to give him some fluids and take him to the ER. By the way, we may know someone who can help you with your insurance situation. Can we have them call you? Or imagine this. Imagine you could provide emergency medical care to the elderly and help them find resources like in-home care, medical equipment, or in this case, food assistance. You'd say, by the way, did you know a lot of people your age have meals delivered? Would you like to have someone call you about it? And what about that veteran? Imagine if EMS was an access point for veteran services. You could say, "We're glad you called us, let's get you checked out. Do you feel like you have enough support? We may know someone who can help you." But you don't need to imagine this. We've extended the wrap button to include outside referrals. Patient resources are now at your fingertips with the new 211 Referrals. Let's take a look at how it works. Until now, all referrals have gone straight to wrap. When we decided to add 211 referrals, we wanted to make it as easy as possible, so we combined them. You'll make all referrals in the same place, and you don't need to decide which is which, since a computer algorithm does this based on our agency agreement. When you present this to a patient, it's best to tell them you are offering a connection to someone who can help. Steer clear of guaranteeing free stuff. Services change so often, and 211 keeps track of these changes better than anyone else. When you refer a patient, 3 pieces of information in the patient care report are important. A detailed description of why you are referring the patient, a phone number so 211 can call them back, and insurance information. The first thing you'll notice is that this button is going away. You can access the referral page from the ... tab. When you click it, you'll see a pop-up box. Hit Refer Patient. The name is auto-populated unless you haven't filled it out on the front page. In this case, you'll have to enter a name. Note there's a box for the guardian's name too. Next is the button that was moved from the front page. This is where you select the referral category. We know some patients fit all of these categories. Just choose the one you'd like to see addressed first. This comment box is the most important. There's no character limit, so you can put as many details as you need. This will be the main field read by the 211 call taker or RAP paramedic. The next box is where patients can opt out of sharing their information with certain organizations. So, for example, if the patient doesn't want his or her information shared with the HOT team. This doesn't prevent us from sharing information if the law requires it, or if we feel we can get the patient out of a dangerous situation. The next box is the preferred method of contact. Keep in mind that if you forget the phone number on the main page, the system will reject it from 211's inbox. Next, get the patient's signature like you always do. And last, if the patient can't consent, click this box. This will send the referral directly to RAP instead of going through the algorithm. Also, you can see that it will show you how to follow up if you're interested in knowing what happened. At some point, we'd like to create an automatic status update, but for now it's still on the roadmap. And that's it. These referrals aren't difficult, but since they are new, we do expect to find some glitches. I'm sure we'll be learning a lot in the next year. Please email any suggestions to ajensen@sandiego.gov. We look forward to hearing from you.